Something that definitely hits home for taxpayers, especially folks out in California. Pensions. Okay, let's unpack this one. The report kicks off with a frankly startling detail. California state and local government employees, they're apparently earning six-figure pensions every single year for life. That's not just, a nice retirement package. That's a huge commitment. And here's where it gets really interesting, almost hard to believe, actually. These pensions, they're reportedly higher than the highest salary these folks earned while they were working. Just think about that for a second.
Yeah.
More money in retirement than on the job.
Yeah, what's really fascinating, and maybe a bit concerning here, is the report makes it crystal clear. These massive lifetime pensions, they are paid for 100% by taxpayers. And if you connect those dots, you see, it's not just about generous benefits, is it? It's almost like an intergenerational wealth transfer. It raises some serious questions about public finances, about fiscal responsibility. How do we even get a system where the people funding it, the average Californian taxpayer, are footing a bill that's actually bigger than the peak salary of the person receiving it? That kind of structure, it's not just a burden now. It's like this massive unfunded liability that could really strain public services down the line. Think schools, roads. Well, this bill just keeps getting bigger.
Okay, so from that big picture, let's zoom right into someone's daily struggle. A surprising change with EBT access. The report brings us this new development with EBT, that's the electronic benefit transfer for food stamps. An American woman using EBT confirmed recently that, new stricter restrictions are happening. They're taking effect right now. And she spelled out exactly what's disallowed now. It's not minor stuff. She said she couldn't buy pre-baked foods, things like croissants, ready-made chicken, muffins, even TV dinners. Or get this, even basic things like soda. It's a really specific list, targeting convenience foods.
Mm-hmm. And she's quoted directly in the report. She said, they want you to be Betty Crocker and just make all your own food. And that quote, it really captures this apparent shift in policy, doesn't it? The reported goal might sound okay, maybe encouraging home cooking, saving money, healthier eating, whatever. But you've got to ask about personal responsibility versus, government stepping maybe too far. You think about the impact. Maybe the person using these benefits works 2 jobs, or they don't have much time, or maybe not even a decent kitchen. This policy, trying to nudge people towards self-sufficiency, could actually just throw up more roadblocks for folks already struggling. It limits choices, makes life harder, not more flexible.
Definitely something to think about. Okay, now for something that sounds, I don't know, like it's from some weird sci-fi movie, but nope, it's real. Happening now. The report mentions Volkswagen. They've released a car where you have to pay extra to get the full horsepower. Yeah, let me just say that again because it sounds nuts. Owners have to pay a monthly fee, about $20, to let their car drive at its top speed. We're not talking about heated seats you unlock later, right? This is a recurring payment for the car's basic performance it already has.
Right. And the comments in the report calling this ridiculous, yeah, totally get that. It really makes you question what owning something even means anymore. We're seeing this wider trend, and it's kind of worrying, frankly. Subscriptions bleeding into physical things we buy. It chips away at the whole idea of ownership. You buy a car, you expect to own, well, the car, all of it. But here, it feels like you're just leasing its main feature. It seems like a way for companies to just keep milking money from you, turning a purchase into a rental. It erodes value for the consumer. It's a slippery slope, isn't it?
It really feels like it. Okay, shifting gears now to something more serious. Pretty somber, actually. The report shares this story. It really pulls at the heartstrings. An American woman crying because her unemployment check just isn't enough to live on. The report gives the facts, lays out her situation. Her weekly benefit is $430. That works out to $1,720 a month.
Mm-hmm. And while you absolutely have to acknowledge the real pain and the tough spot she's in, the report does frame that amount with a specific context. It says this is for not working. And that really highlights this tension, this debate we have around the safety net, right? You have her feeling that it's not enough, especially with costs going up for everyone. But then there's the principle that unemployment is meant to be temporary, a bridge, not a replacement for a job. It's not just about the dollar amount. It's that bigger discussion. How do we balance support with encouraging people back to work, particularly with living costs are climbing so fast?
Yeah, a tough balance. And this next story from the report really hammers home the tough realities for a lot of young families right now. We're introduced to this young American woman. Says she works 40 hours a week, a full-time job, right? And she still can't afford to live and feed her new baby. It's just heartbreaking to hear. She gave this really powerful, raw quote, puts it all in perspective. She said, "I'm just so tired of living and working and doing this every single day and having nothing up post. I don't know how I'm going to get childcare when I have to work 40 hours a week because I can't even afford to feed my family as is." I mean, that's not just asking for help. That's the sound of immense pressure on hardworking people, and it gets worse for her. The report talks about her health struggles, too, she added. "I'm having medical problems. I can't even get into the doctor because x-rays and MRIs are $500, let alone a colonoscopy and endoscopy that I need. Like, I can't afford anything. My doctors cancel my appointments." That just paints such a clear picture of these, systemic problems stopping people, even people trying hard, from getting basic things, basic health care.
And she finished with this really poignant plea. It just resonates. She said, This world is just not meant to be like this. We need to make change for us, for each other, please. What's really striking is how her very personal struggle, it connects directly to these bigger economic forces hitting so many young families. It just shines a spotlight on the devastating real impact of soaring costs, not just on food and rent, but on getting basic health care. Things that, in a healthy society should be reachable for anyone working hard. It's not theory, it's a daily fight.
Yeah, it really is. And building on that, this theme of just basic affordability, the report gives us another really stark comparison. Shows how much things have changed. Someone reflecting on how affordable America used to be. Paints this picture, it sounds almost like fantasy now. 2,500 square feet, 5 bedrooms, 3 baths. We had 5 children. Our bills with our children, all 5 living at home, were between $400 to $700 a month total. For everything. Then they dropped this number from today. And you won't guess it, $830.27. That is my electric bill this month, just electricity, for 1 month. Nearly double what their entire family's bills were back then. And it's more outrageous, honestly. They went on. Okay, full disclosure, that is less than last month. Our bill last month was $1,130.98. I'm sorry, it's insane. That is my mortgage payment plus more. Okay, I don't know how anybody's expected to pay that. That's not just being annoyed. That's real despair over these crushing costs.
Right. And they finished really emphatically. You can't survive in the world anymore. And if you connect that to the bigger picture, the report points out, younger Americans, they're expected to pay bills like this, $800, $1,100 for just electricity, plus like $2,200 for maybe a studio apartment, plus food, gas, everything else. It just screams about this generational shift in the cost of living. It's alarming. It really makes you ask, how are young people just starting out supposed to build anything, buy a home, start a family, when just their utility bill could be more than a mortgage payment used to be? It suggests something's fundamentally broken with affordability.
Seriously broken. Okay, next up, this one is a real make it make sense moment from the report. It highlights just how bizarre health insurance pricing can be in America. Someone at a clinic saw a patient forced to pay more just because they had health insurance. Sounds completely backwards, right? Yeah, he described what he saw in the waiting room. I'm at the urgent care today to get a sports physical for my son, and there's a mother checking out from her sick visit with her child, and they charge her $200. And she says, wait a minute, I was told it was $150. Right there, a $50 difference. And the clinic's explanation, this is where it gets just baffling. Oh, that's the cash price, but you have insurance, and we've got to charge you the insurance price. So having insurance literally cost her an extra $50.
The report says the mother, obviously frustrated, tried to just pay the lower cash price. Makes sense, right? But the clinic said flat out, no, we can't, because Blue Cross requires us. If you've got insurance, we've got to put that through Blue Cross. Very well. So she argued, well, that's not fair. I have insurance. I should get a better price, shouldn't I? See, but the clinic's final answer was no. If we charge you a cash price, Blue Cross will take us out of their network. And this situation, it's like a textbook example the report highlights of what some call contractual capture. See, the insurers negotiate these supposedly discounted rates. But if a clinic offers a cash price that's lower than that rate, boom, they risk getting kicked out of the entire insurance network, which is, catastrophic for their business. So the system, it ends up creating these totally perverse incentives. It forces clinics to charge insured patients more rather than just offer a fair cash price.
The guy watching this whole thing, totally fed up, just concluded, that just seems asinine to me. And that's why people are frustrated with insurance. It doesn't work the way that it should. And he added, make it make sense, honestly. It's hard to argue. This isn't just some fluke. It feels like a symptom of a bigger broken system crying out for some common sense. Okay, we're going to wrap up our daily briefing today with a look at a pretty local but significant controversy in Chicago, the Barack Obama Presidential Center. The report highlights that local residents, they are not happy. They're speaking out, and the criticism is sharp. Yeah, the report shares some specific comments from one resident, didn't pull any punches, said it looks like, quote, a big piece of rock kind of right in the middle of what used to be Jackson Park, full of lush flowers, trees, and just beautiful. And all of a sudden, here you've got this big monstrosity. It's over budget. It took way too long to build, and it's ugly. I mean, those are strong words. It points to a real disconnect there.
Right. And the Daily Mail is cited in the report, reminding us that President Barack Obama's promise to build and revitalize blighted neighborhoods was a centerpiece of his first term. But then the report draws this really sharp contrast, connecting that promise to the current complaints, stating that nearly 9 years after he left the Oval Office, he might be destroying one critical area in the city he called home. So this isn't just about, architectural taste. It's about the actual impact on the community.
And the project itself, the details in the report are pretty major. It's an $850 million presidential center supposed to open in April, a huge 19.3-acre facility taking up a big chunk of Jackson Park.
And the critics, according to this report, their main warning is about the direct negative effects. They're saying it's gentrifying the neighborhood, driving up rent, and forcing longtime families right out of their homes, out of their communities. And this really brings up that classic tension you see with these huge urban development projects, especially ones linked to big names. They're often sold as ways to revitalize, bring progress. But sometimes the way they're done just steamrolls the existing community. causes displacement. This report really spotlights that conflict playing out in Chicago, where a project meant to honor a legacy is, well, for some people it feels like it's erasing theirs.